A life-threatening disease has emerged in northern Australia that's starting to worry dog owners. The disease is transmitted through the bite of a bacterium-carrying parasite called the brown dog tick. Its bite can be potentially fatal for dogs. Dr Charlotte Oskam is a senior lecturer at Murdoch University researching tick-borne diseases in animals, and she joins me now. Good afternoon and welcome to you.
Thank you very much for having me.
What do we know about this parasite and where did it come from?
Well, we're still yet to find out exactly where it came from, but we know that the brown dog tick is found globally. It's also found in Australia around the tropical regions where it's warm. And Ehrlichia canis, which is the bacterium that's transmitted by this tick, is also found globally, but only recently, as far back as May last year, that we were actually able to identify it for the first time in dogs in Australia. So this is quite alarming because this disease can be fatal, and until now, we hadn't been actually looking for it, even though it is a notifiable disease.
And so how many dogs, to your knowledge, have been affected by this parasite?
To our knowledge, we're aware of around 300 dogs that have been affected by this disease. Now, this disease, when it's transmitted by the tick, it can take up to a couple of weeks for it to actually show any clinical signs or symptoms in a dog. So the types of signs and signals that you would see in a dog is that it would be losing weight, it may have fever, and to some extreme cases, the dog will actually bleed from its nose. And so looking out for those sort of signs and having good communication with your vet is the best way to try and identify whether your dog's been affected by this.
And so can early attention actually save the dog?
Yes. So if you're able to identify that your dog has got canine ehrlichiosis, then it can be treated by antimicrobials. But because this is an exotic tick-borne disease, a lot of people haven't been looking for it. So making sure that we're aware that canine ehrlichiosis is in Australia, that's the first step to try and helping these dogs and saving their lives.
Will regular tick treatment that many dogs, presumably around Australia, already take prevent any symptoms if they are actually bitten by this parasite?
Yeah, so there's a range of different tick treatments or anti-tick treatments available for people or for their pets in Australia, and a lot of them will protect against the brown dog tick, which has been associated with this nasty disease. So it's just making sure that you keep on top of regular treatment, whether it's a spot on or whether it's a collar. There's different types that you can treat your dog against these ticks, and having a good communication with your local veterinarian. So a lot of people, they might be starting to move around in the neighbourhood, in the bush areas, and if you're not regularly treating your dogs, then they might come into contact with ticks.
Can you just recap which geographical areas around Australia are of interest to you in relation to this particular tick?
So this tick is known within the northern regions of Australia, so northern WA, Northern Territory, even down into some regions of South Australia and the top parts of Queensland. The bacterium has been found in the top of WA, Northern Territory, and has been affecting dogs there. To my knowledge, it hasn't been affecting dogs in South Australia, although the ticks in South Australia have been identified to carry this bug. So, but from our research, we've known that this tick is starting to migrate further south into more populous regions. We've identified this tick in Perth before, so it might be a matter of time before this nasty disease comes south.
And have any people been reported with having this particular tick bite?
Not in Australia, not the disease in Australia, but this tick can bite people, not regularly. Its preferred host is actually a dog. hence the brown dog tick name. But overseas, there have been very small reports of this disease affecting people.
Dr Charlotte Oskam from Murdoch University, great to speak to you. Thank you.
Thank you so much.